Hello and welcome to our presentation about the Enhancing Generalist Skills Programme. I'm Tarima Matin, National Clinical Advisor for Education Reform and Consultant Radiologist, and along with my colleagues, we're really excited to tell you about Enhance and how it will develop our integrated healthcare teams. Next slide, please. The Enhancing Generalist Skills Programme is a strategic priority for medical education reform here at Health Education England. Medical education reform aims to ensure that doctors are equipped to tackle the increasingly diverse and complex health challenges we face. And the reform agenda is built upon the experiences and learning from COVID. So, for example, flattening of the leadership hierarchies, more seamless team working across teams and organisations, and also more shared accountability. It's also built upon the findings from the Future Doctor Report. The Future Doctor Report was published in the summer of 2020, and it defined the role of future doctors in the transformed multi-professional team. It also described the changes in education and training that were required to achieve this co-created vision. One of the key findings was the need for all doctors, and in fact all healthcare professionals, to have a broad range of generalist skills. And our Enhance programme, the Enhancing Generalist Skills programme, is the way in which we hope to implement this vision. There are lots of opportunities with the emerging integrated care systems and the NHS long-term plan ambitions to ensure that our learning opportunities that we create in the Enhance offer will really develop the healthcare workforce to deliver truly patient-centred and integrated care. Next slide, please. So what are enhanced generalist skills? I think it's safe to say that the term generalism and generalist skills can be very widely interpreted, and it really does mean something different to everyone. The generalist skills that we're trying to deliver through our Enhanced programme have already been very clearly defined by the Future Doctor Report. These are the skills that all healthcare professions need to support whole person care. So really take that holistic approach to understand population health, move away from disease treatment towards health promotion, address local health priorities, really understand the communities that all healthcare professionals are serving to ultimately reduce health inequalities. So we're really trying to implement this new type of learning through a professional development offer, and this will be interwoven across current training programs and pathways. And the generalist skills offer is being developed regionally across the 7 health education regions. We felt it's really important that this offer is both an attractive offer for learners, but also that it really speaks to or meets region-specific health and care needs. So we asked our regional clinical leads to really think about what's the art of the possible, to test ideas and to put forward some pilot or trailblazer proposals, which we'll tell you a bit more about later on during the presentation. I'm now going to hand over to Sophie, who will describe the Enhance offer from the doctor perspective.
Hello, my name is Sophie Smith. I'm one of the National Enhance Fellows, and I also work clinically in geriatric medicine in Salford in the Northwest. So from this slide, you can see the diagram of medical postgraduate training, and the main target at the moment of the Enhanced programme is the early years doctors, so your foundation doctors and the early years core training. But our ultimate ambition is for this programme to be multi-professional and to be as fully inclusive as possible, so also involving our locally employed doctors, SAS doctors, FY3s, and other broader healthcare professionals as well, so physios, occupational therapists, and our advanced practitioners as well. I think it's very important to be clear about what this programme is, and it's trying to offer additional enhancing skills rather than trying to create a new specialty or a new CCT or creating a new type of GP, which it definitely isn't. It's trying to augment and potentiate what we're all already doing in our clinical work. I'll hand over to Jo now.
Thank you so much, Sophie. Hello, everyone. I'm Jo Schramm. I'm a clinical advisor in the Medical Education Reform Programme at HEE, and I'm a consultant respiratory physician. When we started to construct this programme, we took the information that we'd heard from the Future Doctor work and the report and tried to encapsulate that in a way that would become clear for a learner approaching this offer in a way that would allow them to see what benefit they might gain in terms of their professional development. So we settled upon a core element of delivering integrated person-centred care, linking that to the long-term plan priorities and the way that our healthcare systems are currently being reimagined. We focused on the need to collaborate, to work in partnership, and the challenge that many of our learners and even those of us who are experienced clinicians face regularly around sharing uncertainty and sharing decision making with our patients, but also our wider teams across professions, disciplines, and the wide system and community. So really that's the core part of our offer, and that is absolutely embedded within the current curricula, which I'll discuss shortly. We also felt it important to prioritise some other more contemporary areas of practice that perhaps are a little underserved currently in our training programmes. And we focused really on 3 areas here. So one is around social accountability. There is no denying the need to address health inequalities. Everybody in our current NHS is focusing on this, and we feel that our learners really need to be equipped to participate in that work and learn through active involvement in the work that's ongoing in order to learn and work at the same time. We feel that the global agenda of sustainability is very important as well, and the issues of equity and social justice are also equally important, both within our patients but also within our staff groups. We also have an area to focus on around systems, and we've already discussed the fact that our systems are changing into these integrated healthcare system structures, and it's important if you work within a system to understand it, to be able to navigate within and across it, and therefore be able to influence how it develops and be able to transform care within it. So we felt this was an important area for all of us to develop. And within that area, we felt that stewardship would also be an important aspect of our work within the current NHS. Finally, the need for understanding and literacy of data has never been more evident. It's one of the key aspects of being a mature, population-focused clinician, to be able to communicate well, not just on an individual basis, but to understand the needs of communities and populations, and to employ data science effectively. And therefore, we have decided to enrich the scientific offer to our learners, which has already been developed in many other ways if one thinks about bench work and clinical research. But the need to better understand available data has never been more important. So we then sought to translate this diagram and these concepts into our current curricula, which are on our next slide. The main issue around curricula is this recent move with the revision from competency to capability. And one definition of capability is shown here, an ability to integrate and apply multiple competencies, but in novel, complex and changing circumstances. And if that doesn't describe the current NHS, then I'm not sure what does. So if we look at how the GMC has thought about this, we could next see that there are generic professional capabilities which are integral to all of the new curricula, from foundation through primary and specialty curricula, which means that that is really the core of being a medical professional currently, and we can see them listed here. So then one can conceive of the specialist capabilities that we all have around that, and that's a very broad range, but obviously will differ with different curricula and across the different medical specialties. So Then we thought about our concept and where it would fit. And here we have put it in as what we've described as general contextual capabilities. So we've taken that idea of applying competencies in context, and you can see the 6 areas or domains that we're working to deliver within our programme listed here. And we describe these as our generalist capabilities. So the next step in the process was to look at outcomes, and I'm going to hand over to Maz now to explain these in a bit more detail.
Thank you, Joe. My name is Maz Amin. I'm also a clinical advisor on the program, and I'm a GP by background. So the enhanced program, as Joe suggested, is an outcome-based program. Here you can see the 7 key outcomes. So we have person-centered approach, complex decision-making, social justice, population health and equity, digital technology and systems, sustainable healthcare, stewardship, communicating complex information, and leading collaboratively, inclusively, and compassionately. So each of these categories have been designed to be complementary to each other. There is overlap between the different outcomes as they're there to support each other. Each category does have its own specific outcomes and modular content. So for example, the third section, social justice and population health and equity, we have a population health digital toolkit that's available on ELF. And what this toolkit is, it's based on a core population health curriculum that's been mapped to various online learning resources out there available to you. So what you do, you look at the outcomes, find out the ones relevant to you, go on the digital toolkit, complete the resources, and add to your capability. Next slide, please. So we have various different resources available through the enhanced program. The key one is the educational handbook, which is the central piece that contains all the core essential information. So please make sure you do read that, as it gives you a good outline of the program. And we have the Learning Hub, we have the website, and our regular newsletters. Just to really highlight that this is a developing, evolving program, so these resources will be updated accordingly. So please do keep up with the comms, look at our newsletters, and yes, and hopefully there will be new sources available. So I will hand you back to Sophie. Thank you.
So the team felt it was very, very important for all of our stakeholders to have a clear framework to use when trying to develop this programme. And the nature of generalism is that it can be quite broad, and it's important that we all look towards the same hymn sheet, as it were. So for our learners, as well as our faculty and supervisors, what exactly is the content going to be? What kind of things are high priority and what do they need to look at? For those in our Trailblazer teams, what kind of learning opportunities within their patch are going to be most useful, most relevant, and where could they link in with other networks as well? For those creating resources for our Learning Hub, what is going to be important to be included, what's the most relevant, and as well as for the broader organisations such as the ICSs, trusts, hospitals, what exactly does this programme mean for them? And also to try and minimise the programme drift. I'll hand over to Jo now.
Thanks, Jo. So we're looking forward to how we're going to scale up our Trailblazers that Jo's just described and move towards full implementation or rollout in 2023. And it's really important that we evaluate the Trailblazers, really learn what was good and what was not so good, so that we can determine what is the optimal mode of delivery for implementation. But we also really want to support regions so that their model of delivery really aligns with those region-specific health and care needs. So we're developing some high-level guiding principles that are shown here, and these will allow for some consistency, but still promote flexibility across the regions. And the guiding principles will really ensure that this enhanced offer is first and foremost available to all healthcare professionals. It will improve the breadth of knowledge and skills of healthcare professionals in both personalised care, but also value-based care. So all of this leading to a really patient-centred approach. It will improve the learning experience of all healthcare professionals through a lot more multidisciplinary and multi-professional learning, cross-sector working, promotion of self-determined development, and also creation of new place-based learning opportunities. So these opportunities will really align with the long-term plan and maturing integrated care system agendas, but also enable these learners to become very much more embedded within a community. It's hoped that the offer will encourage trainees to work across their local system, but so that they also have an opportunity to branch out from traditional training pathways. They can take breaks at different levels, but really be supported to return to training. And finally, the offer is going to be underpinned by rigorous academic programs. And these are really to ensure that we continue to build an evidence base that is really supports enhanced generalist skills, showcases its advantages, and really demonstrates tangible impact of these new working practices across the wider system. I'll now hand back to Sophie to discuss the potential benefits of the programme.
So we think that there are lots of potential benefits from this very exciting programme, most importantly to our patients in terms of improving their experience and hopefully outcomes of receiving the healthcare that we deliver, and trying to improve the accessibility and equity of healthcare as well. In terms of our learners, this is new additional learning, looking at something slightly broader than just pure clinical work, which could be very stimulating and rewarding in and of itself, and to include within their careers as they go forwards. Hopefully bring in a greater degree of flexibility, which is important to our learner population, and also for the wider system itself within the NHS. This programme strongly aligns to the main aims of the emerging ICSs, and hopefully people within the workforce who are stimulated and engaged within their careers, it should also translate into better productivity. I'll hand back over to Jo now.
So we really hope you've enjoyed our presentation, and we have some questions for you. You may have other questions that you've been thinking about, but we feel these are really important and we'd love to hear from you. So the first one is around work that you're doing currently. So how does this programme connect in? Can you see a path for this to be interwoven into the work that you're doing, whether that's education, service provision, design, or other organisational roles? The second is around engagement, and we have been working quite hard to reach out to people who we understand might be interested in what we're doing, but we are always happy to hear about other programmes and other organisations and other individuals that would be interested in what we're doing. And so engaging as widely as possible is really important to us, and we would love to know if there's another way that we might be able to spread this information and our message. We would like even more collaboration than we've had already. It's always useful to hear different perspectives, and we would particularly like to hear from anyone who'd like to link in with us in this work. And then finally, we've come across a number of people who are what we would term champions in the practice of already having enhanced generalist skills. These are colleagues within clinical professions of all types who work across system boundaries, who deliver person-centred care with a variety of different groups and individuals within multi-professional teams. And we feel it's really important for our learners to see where a programme like this might lead them one day in their professional development and their careers. So if any of those questions are of interest, or you have other ones, we'd love you to contact us. We have an email, enhance@hee.nhs.uk, so please drop us a line there. And if you'd like more information about how to get in touch with the regional teams and their trailblazers, then there are some links on our website, which is at the bottom of this slide, and you can find by searching for Enhanced Generalist Skills HEE in any popular search engine. So I'd like to say thank you for listening, and we really look forward to hearing from you. And I'm sure we'll be back at some point with an update on how we're getting on. Thank you very much to my colleagues who have helped me with this presentation too. It's a real team effort. So there's some people also not on camera that we'd like to also acknowledge. So thank you to the whole Enhance team.